Hello, this is Dr. Tushar Shah. Today is the 10th of August and the 33rd day of our program on outpatient management of COVID-19. Today's topic, Pharmacotherapy Protocols at home. One of you had requested me to give protocols of treatment, just like they give them in the hospital. In the hospital, they use severity to give protocols. Mild disease, so-and-so medicines, moderate, so-and-so medicines. At home, let us invert the process. We will give protocols in 5 categories depending on the medicines to be given. So protocol 1, friends, is the one in which only vitamins are given. In which patients would you give only vitamins? In patients who are asymptomatic, only vitamins. In patients who only have anosmia or ageusia, only vitamins, nothing else. Protocol 2, friends, is the one in which vitamins are given with symptomatic treatment only. So you will treat symptoms like fever, body ache with paracetamol, you will treat anxiety with whatever drug you like, you will treat cough and cold with cough suppressants, antihistaminics or decongestants, only vitamins and symptomatic treatment. That will be the protocol 2. In which patients will you do this? In patients who have mild disease and those who do not require favipiravir. So that brings us to protocol 3. The one in which favipiravir is to be used with vitamins and symptomatic treatment. Favipiravir we have discussed in detail previously, and I just would like you to go through favipiravir literature. So just reminding you again, salient points: favipiravir to be used in patients who have comorbidities, patients who have aged more than 60, patients who have evidence of severe clinical viremia, and patients who are not pregnant, do not have CKD, and those in whom the infection is less than 7 days so far in duration. But you can read about favipiravir in detail in the previous posts. So this was protocol 3. I'll remind you, protocol 1, the one in which vitamins were given. Protocol 2, the one in which vitamins and symptomatic treatment. Protocol 3, the one in which vitamins, symptomatic treatment and favipiravir are given. What is protocol 4, friends? It is the one in which anticoagulation is also used. Do we give anticoagulation at home is a matter of great debate and controversy. I think, and this is I'm going a step into the future probably, and going out on a limb also, because I'm going to say something that will generate a debate. I think there will be some patients who deserve anticoagulation at home even without deserving hospitalization. We know that hypoxia requires hospitalization. We know that hypoxia requires steroids. We do know that anticoagulation may be required in patients who do not require oxygen or steroids. So there are some patients who have comorbidities, who are aged, and whose D-dimer is say 1000 plus. Now in these patients, if they do not have hypoxia, have a D-dimer which is high, do not have severe signs of viremia, are not sick enough to be hospitalized, what do? Do you ignore the D-dimer or do you give anticoagulation at home? I believe that if you do 2 serial D-dimers, maybe on 2 consecutive days, and if there's a rising D-dimer, that will mean that this D-dimer is not false positive. It is abnormal and it is due to COVID-19 hypercoagulability state. Now, if a patient has rising D-dimer more than 1000, I am tempted to give anticoagulation at home, and this will be usually in the form of oral anticoagulation, which is our NOACs like Eliquis, which is apixaban, or it can be in the form of Clexane at home, which if feasible. Controversial area, and we will have more debates on this later. That was protocol number 4. And what is the 5th protocol? The protocol 5 is the one in which you will have to treat a hypoxic patient at home very, very reluctantly. Once in a while, I hope it does not happen very often, once in a while you'll have a situation where the patient cannot be shifted to a hospital or will not agree to shift to a hospital. A patient who's bedridden, who's moribund, whose life expectancy is not long, the relatives may decide, no, we will do whatever it takes at home. We would like you to treat, we will not leave him alone without medications, but not in the hospital. In such patients, you might want to give the works. you will give maybe remdesivir injectable or favipiravir oral. You might give dexamethasone injectable or oral. You might give anticoagulants injectable or oral. This is a very reluctant situation, and I myself am not yet prepared to do this. But again, we may have to do this in some rare cases. So 5 protocols: the one in which only vitamins, the one in which vitamins and symptomatic treatment, the one in which vitamins, symptomatic treatment and favipiravir, the one in which anticoagulants will be given at home, and the one in which hypoxic patients very reluctantly will be treated at home. Well, I hope you agree with these protocols. Thank you so much.